13 is now at 5 is back with a report raising questions about the future of health care access in rural Virginia.
Yeah, the report claims 13 rural hospitals across the Commonwealth are at risk of closure, with some facing what the report describes as an immediate threat.
Health care advocates point to federal changes to Medicaid Affordable Care Act funding, warning the impact could hit underserved communities hard. Leila Cox joins us now with a closer look.
Well, Dana and Janet, the report paints a troubling picture for rural Virginia, where hospitals often serve as both a healthcare lifeline and major economic driver. Today, lawmakers, policy experts, and residents stress that if these facilities close, the effects could ripple through the entire community.
I will say we all see a lot of reports in these positions that we hold. This is one of the most disturbing ones I've ever read.
More than 1/3 of Virginia's rural hospitals could be at risk of closure. That's according to a new report by the Virginia Joint Commission on Healthcare, highlighted during a virtual press conference Tuesday. The report identifies 13 out of 36 rural hospitals across Virginia as either at risk or immediate risk of closing.
For many years, our rural hospitals have been living on the edge. They have a very higher percentage of patients on Medicaid, and especially on the Medicaid expansion program, than perhaps hospitals in other parts of our state. The federal reimbursements have been shifting quite a bit.
Senator Barbara Favola says the issue goes beyond healthcare policy. For many rural communities, the local hospital is the nearest emergency room and a major employer.
Having a robust healthcare system that keeps our population healthy is good for our economy and is good for our families.
Researchers warn closures could force residents to travel significantly farther for emergency treatment and specialized care. Celine Montgomery, a rural healthcare patient with disabilities, says she relies heavily on the care provided right up the street from her home.
And driving a distance is a challenge for me sometimes. There's no Uber or Lyft where I live. And if you're not able to drive, you have to rely on friends and family to drive you. And with the gas prices the way that they are right now, that can be expensive.
The report says Virginia's rural hospitals are particularly vulnerable because many serve aging populations and communities with higher rates of Medicaid enrollment. Leila Cox, 13 News Now.
All right, thanks so much, Leila. And advocates say the report is an early warning sign lawmakers should not ignore.